Good evening, everybody, and welcome to this very special session. I'm Gianfranco Parati. I'm Professor of Cardiology, University of Milan, but I'm also President-elect of the European Society of Cardiology Council on Hypertension and Secretary General of the World Hypertension League. I'm mentioning this because I want to convince you today that we need education worldwide. All societies are pushing for a better education of doctors, because this is a very important step to improve hypertension management and control. And in this session, Professor Asmar, another well-known expert in hypertension, will also help me in describing this very new possibility for education. And Archana will give you a very practical demonstration on how you can use this new tool. And what is it? Well, we need education, as I said, and through the last few years, a new tool was developed by OMRON in collaboration with the European Society of Hypertension and the International Society of Hypertension, the British-Irish Hypertension Society, a tool that might provide doctors with the possibility of an online educational tool on hypertension, its cardiovascular complication, and the ways we can manage it best. It's a very important and ambitious project, but is responding to the need all over the world of an education which could be accessible even in countries where this is not very easy to obtain for a number of reasons. So in my talk, I will introduce you to this new tool, and I will show you how this free, easy to use and up-to-date online education platform might help you managing your hypertensive patient better using updated information provided by scientific societies. And OMRON has been providing the engine and the ideas and the support to make this dream possible. OMRON is providing global education. It's not only producing blood pressure measuring devices, but is also involved in helping us understanding better how to manage hypertension. And the healthcare professionals are in need of continuous education and training because the evidences are changing over the years. And the evidence we have is strongly convincing us that the best weapon we have to fight hypertension and also other diseases is information made available for healthcare professionals. And this academy, the name academy was chosen because it's really a teaching tool, may offer a variety of modules that may help doctors to go deeper in understanding the different aspects of hypertension management and also applying them to specific different populations. These are the scientists involved in the advisory board, Professor Ziufis, Professor Capuccio, Professor Dominica, Professor Mancha, and myself, and we've been working together with OMRON in building this very special tool. And what are the objectives? Well, you will see some example, and you can go yourself then on the web and check it directly, so you'll be able to have your own experience. The OMRON Academy contains 14 training modules for hypertension, and there is another teaching session on respiratory disease for an additional 16 modules. All these modules can be used independently, so you can just use one and then come back maybe a few days later and access another one, very flexible as an approach. One module more or less means 1 hour of classroom training, and this has been used also in presence teaching when this was possible before the COVID pandemic. Some modules are focused mainly on GPs, others are built for nurses or pharmacists, but the main topics are very similar. There is a different perspective, obviously. And whenever necessary, also local guidelines are added to make the teaching personalized to the local situation. Obviously, this modular approach made it possible to arrange sequential trainings in different regions, hospital, pharmacy chains, whatever. So you can organize your teaching very flexibly depending on your needs, on what is the demand in a local situation. Of course, using all modules in a session is also possible, but this means one full day of training, which is not always easy or feasible, but can be done in specific situations. For young doctors, for example, they want to have very intensive training concentrated. The content of these modules can also be used during symposium lectures or during a national congress, where you can organize within a congress your teaching activity, which has been done already in some national congresses in the last few years. And all these modules are constantly updated with the latest scientific information. So all the new guidelines coming are used to update the content of this teaching tool. The project started years ago as a classroom initiative, as I said. It was started initially with the idea to provide the material for local education in presence for those countries where there is a limited possibility to receive education, or it's also difficult to receive regular updates when the new guidelines become available. And this was indeed done in many countries all over the world. It was done in Russia, in Latin America, in Africa, in some other countries where at the time it was not easy to have easily accessible the most recent education. It was working very well. Then a next step in the perspective of bigger reach was to organize an online version. And the online OMRON Academy was launched then in the last few years. This was obviously very timely because the COVID situation has been boosting this perspective even more. It would be impossible now in these months to organize any teaching in presence, as you will see also for this session, which is also virtual, unfortunately, but this can be effective anyway. And the OMRON Academy can be accessed virtually from your computer, for your smartphone, but having the proper link. So in this particular situation, then, the OMRON Academy was also facilitated by the scientific societies who made their website facilities available. So you can find a link to the OMRON Academy also on the website of the ESH, the ISH, and the British-Irish Hypertension Society. And we recently also made the OMRON Academy available to our ESH Care app, the application for smartphones we developed within ESH a few years ago, which is now still freely available. It's been recently updated, and you can download it even now on your smartphone just by typing ESH Care on the research engines for your phone, either Android or Apple. Of course, the OMRON Academy can be used also for other purposes. And now we have just prepared a quite comprehensive position paper on the use of home blood pressure monitoring. We have been working for a couple of years, quite a hard work, to summarize all the evidence available at the moment. And this is going to be submitted in the next few days. And when available, when this will be published, this will be accessible also through the OMRON Academy. We use also as a tool to spread the access also to this paper that is important all over the world to make a better use of blood pressure measurement facilities, including home blood pressure monitoring. Considering again the OMRON Academy, when you access it online, it has been remodulated to be compatible with an online access. When you have a physical meeting in presence, you might get 1 hour discussion, even more, you can discuss more freely, but if you go online, as you know, it can be very boring if you have to spend too much time in front of a screen. So the education has been remodulated into short modules, 10-15 minutes of use maximum, where you can highlight the specific challenges in the different fields of hypertension, the updates, and all the details you might need to learn in a relatively quick manner. For example, you have a session on hypertension guidelines, hypertension in pregnancy, hypertension associated with comorbidities such as diabetes, the metabolic syndrome, obesity, CKD, hypertension monitoring and follow-up with all the details on blood pressure measurement at home over the 24 hours or in the office. Then also nocturnal hypertension and sleep apnea. We have also a module on ECG that's very important for GPs. So you can have very easy teaching on ECG, including different possibilities also on the move, and then remote patient monitoring using the facilities offered by modern digital health and telemedicine. The partners, as I mentioned before, of this initiative are the European Society of Hypertension, the International Society of Hypertension, and the British-Irish Hypertension Society. All the societies participating in this meeting, by the way. That's why we are organizing this special session in the frame of the Congress. And ESH in particular was collaborating with OMRON in organizing the curriculum for this teaching activity, allowing the use of the ESH logo on the program material, and offering some publicity to the OMRON Academy and offering the website, as I mentioned before. The same was done by ISH and also by the British-Irish Hypertension Society. And last but not least, the ESH Care app, you see the screenshot of this app, which is allowing you to store your blood pressure values, your body weight, your height, can provide educational material regularly updated, can connect the patient with the doctor. You can send your doctor some information if the doctor agrees, obviously, and then you can communicate with your doctor and also locate the excellence centers all over Europe. Well, this app has been updated, as you see, with the link to the OMRON Academy directly. And Archana will show you how you can do it very simply when you download the new version of the app made available just a few days ago with these new possibilities. As I said, you can input your blood pressure values, have a graph showing the blood pressure profile and the trends over time. You can input body weight and height and calculate the body mass index. You can have educational information, for example, importance of atrial fibrillation in hypertension and stroke prevention, how to change your lifestyle, what are the dangers of hypertension, very simple stuff for the lay population, but important for doctors to provide education very simply without investing too much time, by giving a tool that can be used at home by the patient as well. And these are the location of the center, in this case Italy, but we have all Europe here and even some countries outside Europe. And then obviously the access to the OMRON Academy, which is acknowledged on the development bodies, and then there is a very simple button to press to access the education from your phone. The British-Irish Hypertension Society was very importantly involved in this process. They developed a part of the curriculum of the OMRON Academy for hypertension, and they were also offering their logo on the program material, and of course also the access to the website. And in the OMRON Academy, you can also find a way to access the recent guidelines. So the European, the ESH guidelines, and the British-Irish Hypertension Society guideline, the NICE guideline, can also be accessed through this educational tool. Just to summarize then, is a teamwork, as you have well understood. OMRON as a company giving the engine to this initiative, and then the collaboration with medical doctors, with master trainers, business partners, pharmacists, GPs, nurses, health authorities, and scientific societies. A very important teamwork that has led to a very important, simple, but comprehensive educational tool. And just to show you the steps that led to the development of the online Academy. We started with a content request that was prepared with the help of the key opinion leaders, and this led to the slide deck creation that was reviewed and approved by the medical society. So really a teamwork here. Then it was finalized in English, so we have a slide deck in English as the backbone for this initiative. We then was divided into 10-15 minutes topics to organize the short modules I was mentioning before. This was further developed into interactive modules with some question and answer also provided, and then was again reviewed and approved by the medical societies. And after that, it was approved as online modules that became available and actively accessible online in English. It was also translated in other different languages, because this is an international initiative, not only European or American, and this is facilitating access by many other countries. You find here the available languages at the moment. This is the link through which you can access the OMRON Academy also from your computer or from your smartphone, and you find the version in English, German, Italian, Spanish, French, Vietnamese, Russian, Thai, and Indonesian. Also the Polish and the Turkish languages are now coming up. So quite an engaging initiative, a lot of work, but a very nice educational tool that you are welcome to try yourself. Thank you for your attention. And now I will ask Professor Asmar to provide further details on this important educational tool. Please, Roland.
Thank you, Mr. Chairman. Thank you, Gianfranco, for this very nice introduction. I would like also to thank the organization committee, the European Society of Hypertension, for this, for me, first ESH virtual meeting. And my thanks also to the OMRON company for their invitation, which allowed me to share some words about this OMRON Academy, very well introduced by our chairman. I fully agree with you, Gianfranco, that this OMRON Academy was maybe important at the beginning when it was initiated about 1 year, 2 years ago. But in my opinion, it's becoming more and more important since the COVID lockdown, because they switched to the online education, and this is becoming crucial at this moment. So you heard about the OMRON Academy. Let me share some details of it. Gianfranco done a very nice overview about it. Let me give you some details. First, here you have my disclosure. I'm a speaker in a sponsored symposia like this symposium, but I do not have any direct commercial interest related to this presentation. What is OMRON Academy? Gianfranco said that it's a kind of partnership. Indeed, OMRON Academy, it's a partnership. It's a partnership between who and who. It's a partnership between the OMRON company and the scientific societies. They developed two fields, the respiratory one and the cardiovascular, the hypertension one. In the hypertension area, the partnership was between OMRON and, let's say, the international important scientific society in hypertension, the British-Irish Hypertension Society, the International Society of Hypertension, and the European Society of Hypertension. So it's a partnership between these scientific societies and OMRON company. This partnership was done for what exactly? Again, as Gianfranco said in his introduction, it was done to provide a continuous medical education endorsed by these societies and accredited by the at the national level. So a very high scientific quality CME models. At the beginning, it was organized and designed as a classical classroom meeting, and then it was switched to the online since almost 1 year. There is two important area developed up to date. The first one was the respiratory with number of models. Here I have 8, but there is much more. And the one we are interested by today, it's the hypertension one, and there is about 14 models developed up to date in hypertension. So it's a partnership between OMRON and the scientific society to do what? To provide a high quality, scientifically updated CME. To do this, as you said, the first step was to establish an advisory board. An advisory board which include very well-known people. Gianfranco, you are here with us with all your background in hypertension. We have Professor Mancia, who is one of the co-founder of the European Society of Hypertension. We have Professor Dominishak. She is the former president of the European Society, and she is in the board of the International Society of Hypertension. We have Professor Cappuccio in the British-Irish Hypertension Society, and Professor the past president of the European Society. So we have this advisory board to do what? To be and to guarantee that the latest scientific development, which are the guidelines, are really represented and in these models. let's say, to be the guarantee of the high scientific quality of the models. And this OMRON Academy, it's providing models in a very distinguished and elegant way and very simple way, and we will see it later on with the Arcana maybe. The design of the models were very, very interesting. This was include different step as you show it. It's interactive, innovative, but the much important for me is this easy to use approach in these models. And based on what? Based on the guidelines, the European Society of Cardiology and of Hypertension guidelines, the British guidelines, the NICE guidelines, but also with some adaptation. When we go to at the national level, we may include some national adaptation of these models. So high quality, scientific quality, including and based on the international guidelines. Let me give you some examples here in hypertension. This is, I would say, an update issue in hypertension. You hear a lot about the nocturnal blood pressure, the sleep disturbances, and the sleep apnea, and so on. So we have different models: the sleep, the nocturnal blood pressure, the sleep apnea. If you go to the blood pressure measurement, we have also several ones. The blood pressure measurement by itself, the ambulatory blood pressure over 24 hours, but also the home blood pressure monitoring. And I'm very happy here to hear from Gianfranco that the very soon published paper, which is the practice guidelines on home blood pressure monitoring, will be included in the OMRON Academy. So about the sleep and nocturnal blood pressure, number of models on the blood pressure measurement by itself, 24-hour, HBPM, and separate. About the remote patient monitoring, and here this chapter is becoming more and more important since the COVID lockdown. I don't know elsewhere, but in France, we are using since 1 year a lot of this telemonitoring and teleconsultation issue. So there is model on the self-monitoring of blood pressure, on the remote management of the patient, like the teleconsultation, and one on regarding the implementation guide. And here maybe we will see more with the Arcana. There is a number of models on EKG, like bradycardia, tachycardia, atrial fibrillation, and so on. There is also some models based on the guidelines, including the definition, the classification, the diagnosis of hypertension, the different kind of hypertension, the white coat, the masked hypertension, and so on. The target organ damages, the hypertension-mediated target organ damages, and the strategy of the treatment, both of the non-pharmacological treatment and the pharmacological treatment. And here, also, it can be important in the management of the patient. For the pregnant woman, again, a number of models has been already developed. The blood pressure measurement in the pregnancy, which is something, let's say, very specific to this population. The guidelines of hypertension in the pregnant woman, and the treatment of hypertension in pregnancy. In terms of comorbidity, number of chapters, number of models has been have been already developed. We have the atrial fibrillation, we have the CKD, the chronic kidney disease, the metabolic syndrome, the obesity, the diabetes, and in some area, the association between hypertension and diabetes is very, very frequent, and it's already included in these models. So, partnership between OMRON scientific societies to do a very high quality and very well designed models on hypertension with different chapters. More than 14 models has been developed. To who? For who? At the beginning, maybe it was thought that we will cover mainly the general practitioner, but now the OMRON Academy, it's providing a solid CME to support all the health provider, not only the general practitioner or the family doctors, but also the pharmacist, the medical and the pharmacy student, and all the other health professional, by providing this, because they can take benefit from this. And as I told you in the beginning, these models are accredited by number of CME points. As an example, I'm giving you here in Germany, the models has been awarded by 7 CME points for GPs. In Italy also, I believe that it was accredited by number of CME for GPs and for pediatrician also. So how we can do it? How we can take benefit from this? At the beginning, as we said, it was designed to be like a classical classroom training, a half-day, 1-hour training, a classical training performed by a first-class trainer, who those trainers were trained by experts in the field. So the trainer doing the animation and this classroom were trained to do this. But since more than 1 year now, they developed, which is an extraordinary issue, the online available models. So the models are available online, and we will see it how. This will make it possible to learn anywhere, anytime. This means, because doctors are, the health professional have now a very limited time, it's something very important for them to choose their time to learn. So it can be done anywhere, anytime, using this online available models. As Gianfranco showed, when the classical classroom were launched about more than 1 year, 1.5 years, it was very popular. Here you have some examples in Europe, Poland, Germany, UK, Italy, Croatia, Romania, but also in Africa and North Africa, Morocco, Nigeria, in the Middle East, United Arab Emirates, and even in Asia. So it was very popular. When we switch to the online, one of the advantage of this online, I told you that it's accessible anytime from anywhere, but it can be done using different platforms. It can be done using the computers or a laptop. It can be done using any tablet, and it can be done using a mobile phone platform. And again, I'm very glad today to hear from Gianfranco that this OMRON Academy is now included in the European Society of Hypertension Care app. So it's included in the Care app of the European of the ESH, which is something very very good. When you do this training, at the end, we have a kind of knowledge questionnaire. You can go through it. It's short. It will take some minutes. And if you succeed, you can obtain a kind of certificate that you passed this, you succeed to pass this model. So it can be also something important. In some countries, it can give you some accreditation point. Let me summarize this in a very short 1-minute video, which will show you the most important point. Up. So this video is summarizing the important point of the OMRON Academy and why it's important. And again, I'm insisting in the online approach of this. And let me share this very good news with you. Very recently, the OMRON Academy has been awarded during the learning technology by receiving the Gold Award 2020 for the design of this learning content. Professor Parati said at the beginning that OMRON was offering the engine, but the way of the design of these models is something very important. It's very attractive. We can do it in a really easy way. So in conclusion, my dear colleague, what's OMRON Academy? OMRON Academy, it's a partnership between OMRON and the national and the international societies here in hypertension, the international society with some adaptation with the national society. This partnership to do what? To provide an approved and high scientific education with certified continuous medical education models. In hypertension, I showed you that we have up to date more than 14 models already developed in hypertension. For who? It's open to the all healthcare providers with very interesting for GPs, pharmacists, students, and so on. We are covering several topics on hypertension and its cardiovascular complication, target organ damages, and treatment. It can be done in two ways, the classical classroom one, but also on the free online access, which is the most important because it's allowing to do this education anytime, anywhere, according to the availability of the healthcare provider. And at the end, it's we can obtain a kind of certificate and we can earn some CME points. Thank you very much.
Contribution. I think we have provided a frame. Actually, we have to acknowledge that this session was conceived when the ESH Congress in Glasgow was supposed to be in presence. So we're planning a session with a series of tables with tablets and smartphones available for all of you being seated there and try personally to access and to do some exercise. So we designed very short speeches, very few speeches as well, and a lot of time for training. Now we are found in a virtual mode, so no computers, no classroom, no tablets, just a screen and you and us. And now Archana will do all the the best she can to reproduce the training session as it was conceived. So Archana, you have a very important task now, which is to show in practice how all what we have been saying translates into an easy access, into a profitable teaching and learning. So please, we need your help to show how it works now.
Thank you, Professor Parati and Professor Asmar, for your introduction and explanation of OMRON Academy Online. And I would actually first like to mention that we are very proud to collaborate on this with the ISH, ESH, and the BIHS to offer healthcare professionals the most relevant and up-to-date information about cardiovascular topics. So for the demonstration purposes, I would like to start with how to find and access OMRON Academy Online. You can find the platform directly via the professional website of OMRON Healthcare. And you can also find the platform on the recently updated ESH Care app, which can be downloaded on iOS or Android. And once downloaded the app, you can enter by clicking on any of the two sections for adults or children. After that, you will come to the main menu. And if you click on the three buttons above, you will find the About section. And in the About section, you will find the link to access our platform. You can click on the website link and it will open. Just to mention, the platform has been developed for mobile first, but you can access the platform via any device very easily. And after that, you will find the option to start your training or to log in if you already have an account. But let's first create a new account. So you can enter by start your training, and then you will be redirected to the registration page. Here you can enter your details. And for the demonstration purposes, I'm going to create a fictional account. Right. And I'll be a cardiologist for now. Located in the Netherlands. Right. And then we can submit our details by pressing create an account. After that, you will also receive a welcome message in your inbox, but you can continue actually immediately. And you will come on the home page with a welcome message. So first of all, you will find on top the navigation pane for the two main categories, hypertension, and if you click on the buttons, you will also find the respiratory courses. But for now, let's continue with the hypertension courses. So the next thing that you will see are the themes, such as electrocardiography, remote patient monitoring, and guidelines. And each theme is divided into short topics of 10 to 15 minutes each. These are the courses. So for now, let's find the nocturnal blood pressure course to know more about nocturnal hypertension, which is all the way here. And as you can see, the course on nocturnal blood pressure, and it will take around 15 minutes to complete. So let's start. What you will first see is an introduction of what the course is about. And if we click on start, what you will see is that the information is divided into topics, and you can find the references of the source materials of the information by hovering your mouse over the numbers if you want to know more about a certain topic. The next thing that you will see are the interactive questions. So you can answer the questions and know more about your answer, but also some more relevant information about that question. And you can continue. So for now, I'm going to scroll all the way down. Okay. And when you go all the way to the end of the course, please don't mind my answers, you will come to the knowledge test. And the knowledge test consists of 3 questions related to the source content. So let's click on start and take the test. Let's answer. And once answered, you can click on submit. And here you can also see that how many answers you have correctly answered or incorrect. So let's retry the test again. And this time correctly. So once you click on submit now, oh, more. My apologies. Oh, I think I know what I did wrong now. So as you can see, you can retake the test actually as many times as possible until you have it correctly. that is. Let me just get the right answers. Okay. And now we have passed the test. And the next section is actually a feedback option before you receive your certificate. This is actually a very valuable section for us to make sure that we provide you with the most relevant content for you that meets your expectation and your needs. So you can rate the content course as you like. And if we continue, you will see that you have passed the test and you can download your certificate from here. The next thing that you will see also below is an option to follow other courses. And the certificate, once you have downloaded that, it will look like this. It has the topic name, your name, the date of completion, and the time that you spent on the course. And it also has the signatures of the medical societies endorsing the contents. So after that, you can follow the other recommended courses, or you can go back to the menu. And here, if you click on the menu, you can also access your account to change your details or to add your details. And next to that, you will also see a notification in your certificates. Once you have completed a course, your certificates will be added here. And you can also download your certificates from here. And if you don't have the time to complete a course at once, you don't have to worry, because you can revisit the course at any other time you like, because it saves your progress. And after that, you can sign out. And that's the demonstration. I would like to thank you for your attention. I think it's time to continue with the Q&A now.
Thank you, Chan. Yes, thank you very much. Very clear demonstration. You did your job nicely. Thank you. And now we have time for some discussion. Actually, I've seen a question here coming from a colleague from Brazil. The colleague is telling us that they are trying to advance in providing remote blood pressure telemonitoring, but the health professionals still have very preliminary knowledge about the topics, So the OMRON Academy would be a valuable teaching and learning resource for them. What is now the situation in the worldwide distribution of the OMRON Academy? Is it available also in Latin America, for example, or in Asia? How can these colleagues access it?
Thank you.
Of course, the online is always accessible, but have you also thought of some more practical implementation in a structured manner?
Thank you for the question. We actually have our colleagues in Latin America also, but also in Asia, who are in charge of OMRON Academy and also for the rollout of OMRON Academy online. So that is also happening, but I think also because of the COVID times, the classroom sessions weren't able to happen. But the rollout of OMRON Academy online is already happening in Asia and also soon in Latin America, Brazil.
Oh, that's fantastic. And the colleague is also asking something that I might maybe need to discuss myself. He was suggesting the possibility to have OMRON Academy informing about the list of validated devices, a list that should be interesting for different countries. Obviously, this is extremely important, but as you can well imagine, OMRON is a manufacturer. So there is a conflict of interest, in such a case. And then you should find a list of available devices in neutral websites. And for example, as you know, as ESH, initiative. We started with the Stride BP initiative. You can find stridebp.org, a website where you find a list of all the validated devices, and this is a nice initiative supported by ISH, ESH, the World Hypertension League, and many other societies to provide an objective and free of any conflict of interest information on what are the available devices. You can also use this in your country. It's very easy to access. There is another very practical question for you, Archana. A colleague is asking, can you share again the link to access the platform?
Yes, of course.
I can ask the technician whether this is possible, maybe to show again the link.
Yeah, just sharing my presentation. It's opening. It is shared now.
Okay, this is the link. Channa, you want to make any comment?
Yeah, this is the link to OMRON Academy online directly. And of course, it is also available via the ESH Care app.
And this is, again, you already said it, and also Roland was mentioned, this is obviously free. Anybody can access it, you know,
Yes.
you just need to register and that's it, you know. Indeed. Okay, that's very important. Okay, thank you very much. I think this, we can keep this maybe on the screen, see people that's want to check it. Roland, a question for you. In your country, what is the situation? Did the French doctors started using this educational tool already or not yet?
Not yet. It's in the process. As I mentioned, we have the international societies, but we at the national level, the French Society of Hypertension has to sponsor this. And it's under evaluation now with the French Society of Hypertension. I am sure that they will accept it. I am not sure that there will be any adaptation regarding the guidelines, since the French guidelines are almost the same than the European guidelines. So it's something which, in my opinion, is going to be done in a very short time.
That's important because this is something that should reach the general practitioners, you know, because it's spreading knowledge on hypertension management that guidelines sometimes have difficulties, you know, in doing directly reaching the periphery. That's an important point. And Archana, another question for you. What has been so far the access to the OMRON Academy? Do you have any statistics on the use of the Academy in the last few years, for example? Just to have an idea of the number of doctors accessing worldwide.
We launched the Academy in September 2018, and we are promoting it in the UK, France, Germany, Spain, and Italy. And until now, we have around 4,900 doctors who are using the platform, but that's also across the world.
Okay, that's interesting. And going back to the question from the Brazilian colleague, are you also planning a translation in Portuguese?
Not in the near future, but we might indeed consider translating it into Portuguese.
It could be a good initiative to be carried out in cooperation with the local scientific society. For example, if the Portuguese or the Brazilian Hypertension Society wants to help, they might provide you help in translating the local language. That would be easy and quick, you know, and so the academy could be easily available. Something maybe you can discuss directly with our Brazilian colleagues if they have this interest. I think it's very important. Definitely. So based on your data, it's already used by quite a number of doctors, you know. And are you considering also a systematic presentation in the national congresses? Because obviously the best way to promote it is to discuss and show it in the National Hypertension Society's congresses, because people then can be informed, they can have a possibility to try it either virtually or in presence, whatever, as we are doing now. But even virtually, if you have a nice presentation like yours, you can easily see how it works. Have you considered proposing this to different national congresses?
Well, we have, of course, last year, thanks to Professor Asmar, showed it during the French Hypertension Society. And we are also, oh, sorry.
Yeah, yes, I can do a comments here. It was a virtual meeting, but despite the fact that it was a virtual meeting, there was a lot of question about it, and a lot of French doctors were interested by. And I fully agree with Gianfranco. The most important issue now, because it's really attractive in the form what you have done. The contents, no discussion about it. These are the guidelines and very highly scientific, but the form, it's very attractive. And we have to promote it as much as we can at the national level and the international level. I fully agree with you, Gianfranco.
Yeah, because, people usually don't like to read long papers. If you provide a bulky guideline paper, of course, the expert can look at it, they look for details, but in a general practice setting, they need something very flexible, very easy to access like this one, because you have very short statements, short session, Q&A, and you can get evaluated at the end. So it's the right way to promote education in a very practical manner. I like this very much, and that could be definitely the future for that.
Can I ask a question?
Please, sure.
to Archana? Archana, if I understood from your presentation, we can start one session and we can stop the course and then come back and it will be saved, or we have to start from the beginning?
No. You can revisit the course, and when you click on revisit,
okay,
you will enter the course where you left it.
Oh, that's good. That's good.
And even completed courses, once you have completed a course, but after 6 months you would like to access the information again, you can always revisit it.
Okay. Gianfranco, I would like to go back to the question of our colleagues from Brazil about the list of the devices. I fully agree with you that we cannot put this list with the OMRON, because OMRON is by themselves a manufacturer. But maybe now we have this OMRON Academy included in the ESH Care app. Maybe in the ESH Care Lab app, in the application of the ESH Care, we can put a link for the Stride BP.
That's a very good suggestion indeed, because patients need to know what are the brands, the devices reliable, and which device can be chosen, with some confidence, because it has been properly validated. That's a very good point. I will try to implement this for sure.
And my last point to Archana, Archana, all the courses are open to everybody, or some of them are reserved to the, let's say, physician, and some others to the public, or no, they are open?
They are open for all healthcare professionals.
Okay.
We have a few minutes left. Archana, I have a very practical question again. You mentioned, actually I mentioned as well, the ECG module.
Yes.
What is the final aim of having an ECG module? Usually cardiologists do that. It's my task, but why are you including this also in this OMRON Academy?
It's actually for healthcare professionals and mostly general practitioners to have an understanding of ECG readings, because it's becoming more and more important also with the launch of more one-lead ECGs. More general practitioners will be confronted with those readings, with patients coming to them and mentioning, hey, I saw this on, for example, the LeafCore or an iPhone app.
Okay, I wanted you to mention this because I know that also OMRON is launching a new blood pressure measuring device, including the possibility of one ECG lead recording. And I agree that doctors need to be trained how to interpret this, because they don't have the cardiologists right away available. So that's a very good idea, because combining blood pressure and also information on the heart rhythm can be extremely important to screen for atrial fibrillation, for example, and also to provide some information on a very basic, electrocardiographic assessment, very important in daily practice. I don't know whether you agree, Roland.
It's very important for everybody. I will say it's important for the patient. It's important for the physician to understand if there was any bradycardia or tachycardia or arrhythmia during the blood pressure measurement or a simple muscular contraction, or even to some cardiologists, it can be important because there is very close correlation between some blood pressure rising and the modification of the EKG. So it's something very, very interesting.
There is another comment from our Brazilian friend, very important. It's nothing to do with the academy itself, but it's important for the field of blood pressure measurement. Is properly emphasizing that unfortunately many devices, when they're marketed in a given country, they change their name and their model code. So sometimes in the list, you have a list of classic codes for devices, but then they do not correspond to what is officially marketed. One thing we should ask maybe companies to do is to refer to the official code that is listed in a validation website. When they market their own device, they can change whatever fantasy name they want, but having anywhere a reference to the proper code so doctors can understand what they're talking about. So that's a very practical information, but it's part of the real life, situation we have to face daily. So thank you very much. I think it was a great session, and even without the ability to have all the tablets and phones available for our participants, you were really very effective in showing how to use it. And Roland, thank you for providing a clear detail of all these little aspects that make this educational tool extremely attractive. I wish to thank also OMRON for facilitating and organizing this session, but also for providing us not only with blood pressure measuring devices, which are something we appreciate, but also for a possibility to a market-free, unbiased, educational tool made available to scientific societies, handled by scientific societies completely freely and objectively. That's a very important point to clarify, because we don't want any mixture from market, and commercial interest and education. This is a purely educational tool supported by scientific society. And OMRON is providing this free to the medical community, and we wish to thank OMRON for doing this, and thank you, Roland, and you, Archana, for this important contribution you gave to our session. Thank you again. And
thank you, Gianfranco.
Thank you,
Gianfranco. Thank you, Archana.
Soon again.
Thank you.
Have a nice afternoon. Bye-bye.